All right, let's see. So, so you have, which shoulder hurts? The left shoulder. Okay.
Shoulder, do you mean just GH, or are you talking scapulothoracic, or?
Let's find out. So we need a shoulder book. All right, so the three things we need to know before we touch somebody is what?
Pain rating. Pain rating, where it hurts, and what movement.
What movement hurts.
And where the movement.
Right.
Okay.
Okay, so what movement hurts, right?
Do you want to go first?
Sure. I'll do whatever you want.
What
So as
hurts
soon
your
as I go up
shoulder?
here, and it's about a 2 or 3.
Point with one finger where it hurts the most. Okay. And what's your pain rating when you do this?
2 to 3.
2 to 3.
So let me say, I like to treat them I like to treat them in supine, just so we can see that, like you know, range of motion will change if you're sitting versus supine. You know, they might be able to go farther or whatever. So I like to get into the position that you're going to treat them in.
That way, I guess.
All right, let's see here. All right, so let's measure where the range of motion, where the pain stops there. Okay.
The pain stops. Stops or
Yeah.
starts?
Just stops, yeah.
It really gets bad there.
Come out to the side.
It doesn't bother me so much. It's more of this.
Where does it start?
Starts about right there. It clicks and then it starts.
In your 90. Yep, it starts at 90.
90 degrees. And the pain level is what again?
That's about a 3 right there.
A 3. And if you go farther, it's a
It gets up to 4,
A
5,
4?
6,
Okay.
7.
Okay. Do you have a tear in there?
I don't know.
Okay. Okay, so we got the range of motion, right? We got the level of pain, and then we have the point to me with your fingertip. So go ahead and point there.
Right there. Okay.
So she is where? Would you say she's right? I would say maybe page 15 of your shoulder book. What would you say, like right there?
I take it further down once.
Okay, so I would just move down there. You know what I'm saying? So you can navigate. So if this connects right here, if you just move inferior here, then that connects down there.
Okay.
So I would do all in there. So ipsilateral.
Lateral leg.
Yep. Patient positioning, angle of pressure. So LL8 is highlighted. So I would find LL8 and then go down like
Is
into
that
there.
the one that I'm
Yep.
painting up
Mm-hmm.
here and then 2 here?
Mm-hmm.
Roll down here.
Yep.
So
Yeah, we were
where's
doing that
LL8?
with sore.
So you're on LL8 right there.
Okay.
So she's pointing to like right in here. So I would move down like here to here.
So you move
Yeah.
right in here.
Yep. And make sure that that is up.
Neutral.
Knuckles. There you go. So big circles. Is that okay? So she's actually pointing a little bit below on page 15, you know? So what I told her is just move down like two circles below where those 2 purple dots are highlighted on the shin. Does that make sense? That's how you navigate that. So then you can get instant feedback. So go ahead and raise your arm up.
Oh, well, you're doing it.
Yeah.
Yeah, that's better.
So if somebody says it's better, the next thing out of my...
It's about a 2 and I'm going just a little bit further.
Yeah, so she stopped at 90 before, and now she's
about I
high.
can go to 90 in it.
Right, so I would keep doing it for a minute, okay? And then we'll check it, because sometimes it continues to dissipate after that.
Change circle direction and
Doesn't matter. Yeah,
whatever you want to do.
whatever you want to do.
When you said move down a little, did you move distal or?
Yeah, we moved, yeah. She's right there. So after I finish, remember that, or if she finishes, the next thing out of my mouth is always better, worse, or same, right? Give them the option to say the same if it is the same, right?
Has it been a minute?
I think so.
Yeah. Okay, so now go ahead and raise your arm up and say better, worse, or same.
Better.
Yeah.
So she was like wincing before at that point.
Yeah,
So much.
and she was 75 on top.
Yeah. So and then if she says it's better, the next thing out of my mouth is it still there?
Yep.
Okay, so then the next thing out of your mouth is what?
Where does it hurt?
Point to me with your fingertip exactly where,
Where
right?
does it hurt? Now she's a little more posterior.
So she's no longer here anymore. Now she's pointing to a different spot. She's pointing in her posterior shoulder. So we got that, okay? But she, like I said, they usually have pain in other areas of the body.
So now it's more posterior. So
Right.
it's going to go more lateral.
You could do that. Let's check the book. Where
Here's my chromium here.
Okay, so she's kind of like at the insertion of what, Terry's minor maybe? I don't know. What do you guys think?
Below that, maybe?
Somebody give me a, there it is. Like, I mean, what do you guys, what about that? What about page 23? Do you think that it's right there? And we can just do it to check, you know, maybe it is, maybe it isn't. If you do big circles, maybe you'll hit it, right? Yeah, don't worry about that. Is that where she's?
Yep, maybe just a little below that.
Okay, so I would do right in
Look
here.
at that.
So LLH right here, so I'll go inferior, you know, like posterior to LLH.
Was that my main point?
I think you were on LLH and a little lower than that last time. So you were
But
like,
that's my landmark.
yeah, that's your landmark. Yeah.
And is this indicative too if that's sore? That kind of tells.
It doesn't have to be. A lot of people ask that. It doesn't have to be. It may, but it doesn't have to be. So she's kind of like pointing like down in here.
So a little
Yeah.
down, maybe right through here.
Yeah.
You doing okay at that?
What was your pain level last time?
It's about a 2 when I was going up to here, but I mean, now getting up into there, it's about a 5, not a 7.
Yeah, she's starting to move a little bit freer, you know? Before she was wincing, now she's starting to actually move through it. Now go ahead and raise it up again.
Better. Still sore there.
So she no longer has pain, probably up to 140 degrees or so, right? Would you
Yeah,
say?
up to that 90 is easy. No pain at all. Past 90, I can still feel it kind of tight, kind of pulling, maybe like a 1-ish. And then there, it starts to hurt again. 5-ish, 6, 5 probably.
If you bring it out like that, does it hurt? You might be just impinging it, you know? It might just
There's
be-
a little right there.
Yeah, you might be actually just impinging it. What if you go flexion like that? Yeah, you might be just jamming it up against your crummy. Yeah.
Anatomical.
There's something down through there that kind of bugs me too.
So I would do it for the minute, right? And then I would say, you know, better, worse, same, right? Go ahead and raise it up.
Yeah, better.
And then, is it still there, I would ask?
Yep.
And then point to me with your fingertip.
Now it's a little more posterior.
Okay, so we'll hit that.
So now we're going to go. These are the same. But now I would say we're more posterior.
Very majors, I was probably right here. From here to here to there.
I would try like, so she's like moving like, so I would try like down in here, you know, like you were, so if she's moving more medial, then you have to move more, like more posterior, then you have to move more posterior, like down into here, you know? Let's give that a shot.
Oh, my knuckle marks?
Yeah.
Do you typically try to stay, like, if you're on the lower leg, just stay on the lower leg and treat, or do you go lower leg to hand?
To elbow to.
Yeah.
It's
So I'll
refinement.
stay there just so I don't have to reposition your body part. But if it doesn't work, and I've tried 2 to 3 times, then I move to another one. And for whatever reason, that usually works. Okay?
Is that hurting? I'm almost on her feeling head there.
And go ahead and raise your arm up.
Yeah, that feels better.
Much better, much freer range of motion. So remember I said it takes like 3 to 5 times, right? That took 3 different spots. You know, most people have 3 to 5 spots, you know? I think she's just pinching it when she impinges it, when she Who's doing that?
Anatomically.
Is it still there?
Yeah, it's still there. I just can't figure out where.
Would you call it the word pain?
Yeah. Can't figure out where it is. I don't. Something more lateral but lower, right there.
So then she will go on.
Yeah, she's way. You're looking at her tricep now.
Yeah, no longer.
Yeah, but nothing up here anymore. No.
No, I'm feeling some pulling and junk up through my upper trap. But
Pulling or pain?
there's still some pain, like a 1 or a 2 up here with pain.
And where
Versus
is that at?
I have a hard time deciphering it. That pain still feels like it's coming from down here when I'm up there.
I try to.
Where is it? Where? Can we tricep? Way down. So that's like off the beaten path, you know. She's like down like
Way
here.
from her
That's
shoulder.
off of the maps, you know. So so that would actually kind of be like like here, I would say. So try to hit that, and we'll see. That's off your maps, you know. You just kind of like if she moves down, you gotta move down, you know, and you can count the fingers to how many spaces that she moved down on the arm to how many spaces you moved down. And then go ahead and raise your arm up.
Yep, that's better. Quite a bit better.
Yeah, so she's got full range now, right?
Mm-hmm.
So she had 7 out of 10 pain before,
At the top.
and she had 90 degrees. It's 90 degrees it stopped there? Is that safe to say?
Now I'm just stiff.
Now it's just stiff. All right.
Okay, it's all good.
All right, awesome. Good job.